Hello friends, today we will be discussing about a common topic known as scarring alopecia. Alopecia means hair loss. It can be non-scarring like we see in alopecia areata, endogenetic or male pattern hair loss, or it can be scarring. That means in scarring alopecia there will be permanent damage to the hair. Once the hair is lost, there won't be any regrowth. It happens due to some primary cause or it may be due to some secondary event. Primary cause that we commonly encounter known as the lichen planopilaris that leads to patchy loss of hair associated with overlaying pigmentation. Some people may develop itching, some papule kind of thing over that area. It can be associated with skin lesions, sometimes changes associated with the nail, some oral lesions also. Other condition known as pseudo palate or brock, where there will be patchy hair loss, but unlike the previous one, there won't be any pigmentary changes. The disease is very subtle. Of late, we have started encountering more cases of scarring alopecia known as frontal fibrosing alopecia, where there will be parallel receding of the hairline. It can be associated with loss of eyebrows also. It can be secondary to some process like folliculitis. There are certain autoimmune disease. This type of condition what happen, this broadly known as the autoimmune disease. That means our body is targeting there is a certain organ, and here the target is the root, and as it is targeting the root, there will be permanent damage. Once this is lost, that lead to a permanent patchy loss of hair in that area. It can happen to secondary to some event like trauma, like injury. When somebody using the hair very tightly because of the styling pattern, it can lead to traction, that is known as the tractional alopecia. So if you are suffering from scarring alopecia, you must consult your dermatologist at earliest, because the key to management is to control the disease process. Because in this condition, our aim is to control the disease so that you are not developing any new patch, or else your patch is not increasing size. And in medical management, we are not trying to regrow the hair because it's not possible, because there is a permanent damage. So what we do, we diagnose it clinically. We do the microscopy known as a trichoscopy, and also we take the biopsy to diagnose the disease, to look for the activity that help us in controlling the disease process. So first we try some immunomodulators to halt the process. But once the disease is inactive and it has attended the burnt out phase, in that case, as there won't be any regrowth, so to regrow the hair in that area, we can try hair transplantation. So we do routinely in the scarring alopecia, but we take some precautions while approaching hair transplantation in these conditions. But in the other side, like in the secondary cause of scarring alopecia, hair transplant can be done because it's not due to some disease process, but after a certain period of time, we can do successfully. So in summary, if you are suffering from this type of condition, don't delay in taking consultation, don't delay in starting your treatment, don't take extra time trying in self-medication, taking help of others. You must consult a qualified dermatologist, get the treatment early so that we can control the disease process. Once the disease is controlled later, we can think of hair transplantation into the scar. Thank you.